Hi all, welcome to EduWizz Academy. EduWizz Academy provides both offline and online classes for licensing exams like DHA, DOH, and PROMETRIC exams. It's an online application program with a lot of features, which includes 35 hours of theory classes, which are recorded in high density quality. Along with that, there are study materials, mock test, premium questions, and exam practice test. You will also have faculty assistance. So the theory is that theories are recorded, which are exam focused, concise theory topics. Okay, so to know more about our classes, please contact us directly. So without wasting time, let's go to today's discussion. So we are going to discuss about a topic which is the gastrointestinal system, and that is cholecystitis. Okay, cholecystitis. You all know the definition of cholecystitis. It's inflammation of gallbladder. Okay. So what happens if there is an inflammation at the gallbladder is. So before going on that, you have to know what is the function of gallbladder. So function of gallbladder is it stores bile which is produced in the liver. So bile which is produced from the liver comes into the gallbladder and it is stored in the gallbladder. Okay. So when the gallbladder pumps, this bile goes to the intestine through bile duct. When the bile reaches the intestine, it helps in the metabolism, especially in fat metabolism. Okay. So by fat metabolism, we get energy and fat soluble vitamins. Now, what happens if there is inflammation in the gallbladder? If there is inflammation, the gallbladder will get edema, become edematous. And because of this edema, gallbladder will not be able to pump properly. So, because of this ineffective pumping, some amount of bile retains in the gallbladder, which gradually becomes crystals, which is known as gallstones or cholelithiasis. And these stones will slowly move from the gallbladder and obstructs the important ducts which go to the intestines, and those are pancreatic duct, bile duct, and hepatic duct, and all these ducts comes and joins at the common bile duct. So all these enzymes gets obstructed, and which cause subsequent damage in these organs. Like pancreas, it causes pancreatitis, and in liver, it causes hepatitis. So we just focus on cholecystitis. So what happens is that bile will, because of this obstruction by the gallstones, bile will not be able to reach the intestine, which leads to impaired metabolism, especially fat. Okay, so fat is not digested, so patient will not have energy, and patients will not have fat soluble vitamins, which are vitamin A, D, E, and K. Focus these. Now let's go to the topic cholecystitis. Causes are three important causes. One is cholelithiasis, which I mentioned, which is known as gallbladder stones. And second is choledocholithiasis. Choledocholithiasis means the stones will be in the bile duct. Okay. So here we can see this is bile duct. The stone, this is gallstones, which is cholelithiasis, and this is choledocholithiasis. Okay. And third is iatrogenic. Iatrogenic means due to some medical treatment or surgery or procedures. Okay, that is known as iatrogenic. Certain medications causes gallbladder infection, inflammations. Chemotherapies causes gallbladder inflammation. So that is known as iatrogenic cholecystitis. Now coming to clinical features which are most important. First thing is the location of cholecystitis. Gallbladder is located at the area of liver, which is right upper quadrant. So when there is cholecystitis, the pain will be at the right upper quadrant, radiating to the right shoulder or scapulae. So that is important, not just on the right upper quadrant. Pain just at right upper quadrant, which may indicate liver problem, but here the pain at the right upper quadrant radiates into the right shoulder or scapulae. And second, importantly, Murphy sign. Murphy sign means patient will have severe hypersensitivity and breathing difficulty when palpated at the subcostal region at the right upper quadrant. Subcostal region means this black color, this is cost ribs. Subcostal region means below the cost, below the ribs, where the gallbladder is located, which is right upper quadrant. So when you palpate, just like which is showed in the picture, when we will palpate and ask the patient to take a breath. Okay, so what happens is, while breathing, due to this hypersensitivity and pain, patient will not be able to breathe. So that is why I said severe hypersensitivity and difficulty to breathe when patient takes a deep breath and is palpated on the subcostal region. So in short, Murphy sign is performed by palpating the subcostal region during inspiration. Pain is elicited and patient suddenly stops breathing. Okay, this is positive Murphy sign. Another features are clay colored stool, and just like I said, there will be deficiency of vitamin A, D, E and K, which are fat soluble vitamins. And finally, jaundice. Okay, there will also be another feature named steatorrhea, which means fatty stools. Because the fat is not properly digested, it will come through the stool. Okay, now management, first thing is to restrict fat diet. So fat is a common point you have to focus on. And second, antibiotics for infection, IV fluids and NPO. And exact management is surgery, which is cholecystectomy, which means removal of gallbladder. So there are two types of surgery. First is laparoscopic or closed surgery, and second is abdominal or open surgery. So another question which asks usually from cholecystitis is post-operative resting period, or they will ask after how many days can patient will resume their normal activities. Same meaning only. After how many days patient can resume activity means how many days the patient has to take rest. So for open surgery, as you know, comparing to closed surgery, open surgery will require more days of rest. So keep that in mind. For open surgery, 4 to 6 weeks rest, and for closed surgery, 4 to 7 days rest. Okay, so the numbers are almost same, 4 to 6 and 4 to 7. So what you have to keep in mind is that as it is open surgery, it will require more time to heal. So 4 to 6 weeks is for open surgery, 4 to 7 days is for closed surgery. Okay, so post-operatively, and a drainage will be inserted to remove bile from the blood, and the drainage tube is known as T-tube drainage, capital T tube drainage. So what you expect from the T-tube drainage is, since we are inserting this tube to remove bile, greenish secretion is collected. The amount is important. 300 to 500 ml of thick blood tinged bright yellow or to dark green bile drainage for the first 24 hours after the surgery. So for the first 24 hours post-operatively, up to 500 ml of thick green colored or greenish yellow colored secretion, which indicates bile, is expected. Okay, if it is anything more than that, you should inform the doctor. So this is basically cholecystitis. So what we have to focus is that what happens, bile gets obstructed, which resulting in impaired fat metabolism. So there will be impaired fat digestion. So patient will have severe sharp pain at the right upper quadrant. So when the pain gets worse, mostly one of the risk factor which causes the pain is due to eating fatty meals. So due to improper digestion, patient will have pain. So in the management, even after post-operative period, fat restriction is important. Okay. So now let's see what a question related to cholecystitis. A 55-year-old woman presented to the ED with sharp upper right abdominal pain that radiates to the right scapula. While performing the abdominal assessment, patient becomes nauseous and begins vomiting. She states that she has had pain in the upper right quadrant previously, but that this time it was far worse. There is a positive Murphy sign, and an ultrasound confirms gallbladder wall thickening and pericholecystic fluid collections. Which of the following would most likely be associated with her clinical findings? So here it's clearly given all the details, even the diagnosis is given, cholecystitis, thickening of gallbladder wall thickening. So you can split the points into different questions. One, you have to watch the clinical features. You see sharp upper right abdominal pain radiating to right scapula, which indicates feature of cholecystitis. Patient has nausea and vomiting, which is general GI symptoms. Patient's complaint is that pain, it was there, but it is far worse now. So by diagnosis, we confirmed gallbladder wall thickening, which is cholecystitis. And now coming to the question, which of the following would most likely be associated with her clinical findings? So which of the following factor is associated with her clinical findings? So what is her clinical findings? Sharp upper right quadrant pain, which has now become worse. So what will be the reason the patient's pain has become worse? So I have discussed this already. So you will be able to answer this soon. So options are relieved by drinking milk. Second is alleviation with exercise. Triggered by fatty meal. Worsening on empty stomach. So first two options mentions alleviation means relieved, decreased. Okay. Relief by drinking milk. The patient's present problems is the pain has increased. Okay. So you might have to look for that option. Worsening on empty stomach or triggered by fatty meal. So answer you already know. Answer is triggered by fatty meal, because when the patient consume fatty meal, there is no enough bile for fat digestion, which ultimately result in severe pain. So that's why the answer is option C, triggered by fatty meal. So I hope you all understood the today's class. So just like I said, I have given a short description about the classes from our academy. If you want to more about us, please contact us directly. Thank you.